Dr. Ricardo Meade with the Dallas Plastic Surgery Institute says it's okay for younger people to begin researching plastic surgery. A well-trained, board-certified plastic surgeon can help younger patients put together a plan for their future face.
After reading about Botox and seeing the results for some of my older friends, I thought that why not start now and maybe be able to avoid doing something else that's more expensive and time-consuming down the road.
I didn't want to consider surgery yet. But I knew that there were cosmetic options out there, and Dr. Meade was really good about explaining the options that are there for you. And what I love about Dr. Meade too is that I know he'll tell me when we're ready for the next step, whatever that might be, whether it be fillers or eventually down the road, maybe it would be a surgery of some sort.
I think everybody at some point in their life, if they look and see something, you know, I could go in for a refresher. I could potentially make this look better. And there's no particular set age at which point that happens. I don't think one should wait until things have reached a point where I really, quote unquote, need a facelift or really need this done, because you want things to transition smoothly and softly. And if you plan it out like that, you'll probably achieve it.
The plan for a younger patient probably doesn't begin with surgery. Modern-day advancements offer a variety of solutions to delay invasive surgical procedures.
Until a patient is interested in going through that operation, then maybe they should be doing other options that are out there, such as fillers and maybe Botox, and bridge their way to the final day when they're really going to fix things.
I really like the results of the Botox. We just really liked the way it made us look younger, fresher. Our friends were really noticing it. My boss even gave me a huge compliment.
Once we did it and we saw the results, we were definitely hooked, and there's absolutely no downtime.
Dr. Meade says that if possible, patients should use less invasive techniques until they can do the entire facelift at once.
Doing all of your face, your brow, upper, lower lids, neck, especially if everything has aged, and it all has aged equally, then repairing everything at once almost seems logical. There's no judgment involved. There's much less chance for error. If you do one and then the other, the patched and quilted type look is probably something that you're going to have to be dealing with over the course of time.
I am completely open to doing surgery or maybe even a facelift down the line, and it's easy for me to say that now that I know and trust a doctor like Dr. Meade, that I know will do a really good job and is going to do everything he can to get me the results that we want to get. Definitely come see Dr. Meade.